approach on red eyes. Okay. At present, I am working in Sharada Ayurveda Medical College and Hospital in Salapadi, Mangalore as assistant professor. So, why you want to study redness of eyes? I'll tell you one story, okay? When I was doing my internship, I was posted to ophthalmology department. That time one patient came. Patient referred from IPD, 62-year-old female patient referred to ophthalmology department. That patient is having redness of eyes. Immediately by seeing redness of eyes, doctor said, oh, she might be having glaucoma. Then she took history. She asked, are you having eye pain? Yes, she said, yes, I have severe eye pain and severe headache and nausea and vomiting. For the same, I consulted general medicine doctor. Then he admitted me and gave some medicine. Now nausea and vomiting is okay. But patient is having severe eye pain and headache still persist. So, what will be the condition? Immediately, ma'am, according to the history, she said this is an acute acute angle glaucoma, and patient is referred immediately for the treatment. Actually, it is already delayed. Yes. So immediately essential examination is done and patient is immediately referred to intensive glaucoma eye care clinic. Okay. So this is the necessity. Immediate, if you see the redness of eyes, if you know properly the pattern of redness of eyes, you can refer the patient, or is patient requires immediate attention, or is patient is requires only OPD management. That is the decision left to doctor according to the diagnosis. So, pattern of redness is very, very important. It is just a condition. Redness of eye is just a condition. What exactly happens? There, dilated blood vessels causes redness of eyes. Okay, how it occurs? Mainly, this redness of eyes occurs because of any trauma to eyes or nearby eyes, or any eye diseases cause redness of eyes, or any other systemic illness like hypertension or diabetes may cause redness of eyes. Okay. What is the importance? By seeing the pattern of redness of eyes, you can think, oh, this is the involved structure. I mean, patient is might be having eyelid disease, or corneal disease, or conjunctival disease, or uveal tissue pathology. Some like that you can probable approach you can do. Okay. Next, seriousness of illness. If patient is suffering from some angle closure glaucoma, or patient is having some corneal ulceration, that in such condition should be attended as soon as possible. Otherwise, patient may end up with loss of vision. Okay. Next, easy diagnosis along with other signs and symptoms and proper history, proper appropriate examination according to signs and symptoms helps you to diagnose the disease early. Okay. This is the diagrammatic representation of conjunctival injection, the redness of eyes. Okay. So, first one is conjunctival redness. How it looks. See, it is very nicely visible under slit lamp. Okay, slit lamp examination is very, very essential to differentiate redness of eyes. But even you can do torch light examination. Repeated examination gives you thorough knowledge actually. Next, if you see this type of conjunctival congestion, actually the congestion is away from the nervus. So you should think there is some conjunctival pathology. For example, conjunctivitis. Okay. Next, another pattern is pericorneal, or it is also called as circumcorneal or circumlimbal. So here, peri means around. So around cornea. any diseases near to limbus may cause this pericorneal congestion, and some type of conjunctival disorders also may cause this pericorneal congestion. Next is ciliary congestion. So any diseases or disorders deep in intraocular structures, related to intraocular structures, will cause ciliary type of congestion, like iritis or iridocyclitis, like that. Okay. Next is mixed. You can see both, all conjunctival, pericorneal or ciliary congestion complete. This indicates mainly corneal disorders with intraocular irritation. Okay, mainly you can see this type of congestion in case of corneal ulceration. Okay, this is a diagrammatic representation. Of course, practically you may confuse at the beginning. Repeated examination gives you very good idea about the pattern of redness of eyes. Let us see in different structures which causes most common diseases I have covered. Okay, which structural diseases will cause redness of eyes? In eyelid, trichiasis. What is trichiasis? Trichiasis means misdirected cilia. Okay. Here, this misdirected lid margin is normal. The position of lid margin is normal. Just the position of cilia or eyelash is misdirected. So this misdirected cilia may cause injury, or rubbing of this misdirected cilia to eyeball may cause redness of eyes. Most commonly, conjunctival type of congestion will be seen. If there is any corneal abrasion, then you will see pericorneal congestion. Okay. Next is entropion and ectropion. Entropion means what? Entropion means interning of lid margin. Here, lid margin turns inside. Okay. This interning of lid margin rubs the eyeball, and this eyelashes also causes injury to conjunctiva and cornea. This is also called as pseudotrichiasis, because actually in trichiasis there is no interning of lid margin, only cilia gets misdirected. Okay, but in entropion, because of interning of lid margin, it causes the cilia, misdirection of cilia, so it is called as pseudotrichiasis. Okay, so here also conjunctival congestion is more common. If there is any corneal abrasion, then you can see pericorneal congestion. Next is, okay, ectropion. Ectropion means outward lid margin. There are different stages. Mainly here the chronic ectropion causes chronic conjunctivitis. And if there is any the end stage, there is punctal rise, so patient complains of epiphora. That is, in lower eyelid ectropion, you can see epiphora. Epiphora means what? Epiphora means continuous flow of tear, because proper drainage of tear is not happens because of rise of punctum. Okay. So here also you will see conjunctival type of congestion because of chronic conjunctivitis. Next is blepharitis. See, this is a diagrammatic representation. Blepharitis means eyelid. Okay, inflammation of eyelid margin especially. Here different types are there, but you will see, sometimes you will see redness of eyes in blepharitis, mainly in seborrheic type. In seborrheic type of blepharitis, you will see dandruff-like scales in lid margin. Okay, these scales may enter into the eye, so there will be some foreign body sensation. Mainly, patient suffers with conjunctival type of congestion. Okay, see, blepharitis, lid margin is inflamed, and you can see redness of eyes. It is mainly conjunctival congestion. The congestion is away from the limbus. Okay. Next, let us see conjunctival involvement. The diseases which causes redness of eyes related to conjunctiva. Mainly conjunctivitis. There are many types of conjunctivitis actually, but basic and most common conjunctivitis I want to tell you. This is the normal eye here, and next is bacterial conjunctivitis. Okay, bacterial conjunctivitis. In bacterial conjunctivitis, congestion is more marked, but in viral it is moderate. And in viral, sometimes you can see subconjunctival hemorrhage also. Okay, and in bacterial conjunctivitis, you can see white yellowish discharge, and in viral, it is most of the time it is watery. Okay, but in allergic conjunctivitis, the redness of eyes, again here you will see conjunctival congestion only. It is very mild, and in allergic conjunctivitis, patient suffers. More commonly, patient will have history of allergic rhinitis, that is repeated sneezing, itching sensation in the nose, throat or ear with this allergic conjunctivitis. Okay, so proper history is very much essential. And in case of chlamydial infection, there will be moderate conjunctival condition will be seen. See, this is the conjunctival condition. Here, the redness is away from the limbus. Okay. Next is pterygium. This is also most common condition, most common disease. So here, wing-shaped degenerative conjunctiva, which encroaches the cornea slowly. Okay. If it is vascularized, it looks very red. Okay, patient complains redness of eyes, but this is not comes under this core pattern, under pattern of redness of eyes, because of degenerative conjunctiva. Conjunctival vascularization causes redness of eyes. How it looks. See, along with this, patient complains of double vision. If it encroaches cornea, patient complains of double vision, difficulty to move eyeball. And along with that, patient may complain of burning sensation or foreign body sensation. Okay. At the beginning, pterygium most commonly asymptomatic. Next is dry eyes. Okay. In dry eyes, you will see redness of eyes again. Here, at the beginning, patient will have conjunctiva type of congestion because only conjunctiva is involved. Dry eyes means there is pathology in tear secretion. Tear is not secreting properly. Right? So, if it is severe, dry eye is in severe condition and chronic condition, that time patient may have corneal pathology, inflammation of cornea. In that time, patient may show pericorneal congestion, ciliary congestion. Okay. So this is one more. The normal eye will have proper tear secretion, but in dry eye there is no proper tear secretion. Of course, if you take proper history, patient is using a computer or mobile for a long duration every day, and even if you do Schwimmer's test, you'll get to know the value of tear secretion, the severity of tear secretion, and furthermore T-Bird test, etc. will give help you to diagnose the dry eye. Okay. Next, one more presentation of redness of eyes, that is subconjunctival hemorrhage, or it is also called as hypospasm. Hemorrhage or ecchymosis means there is escape of blood from ruptured vessels. Right? So this is one pattern of subconjunctival hemorrhage, leakage of blood in subconjunctival space. Okay. So after seeing subconjunctival hemorrhage, people will think it's grievous, it is a very serious emergency condition. Okay, but actually it is self-limiting. Most of the time it is self-limiting. But see, there is two pattern of two presentation. If you see posterior limit, here you can see posterior limit. You can see posterior limit of hemorrhage. Okay, you can see part of sclera also. right? So you can see posterior limit of hemorrhage here. So you should think there is trauma to local, here local injury to eyeball. Okay, there is no involvement of head or orbit, just local injury to eyeball. If you take proper history, patient will tell history of injury. Even sometimes there is systemic illness also causes conjunctival, subconjunctival hemorrhage. So for that you have to take proper history. So this is one more presentation of subconjunctival hemorrhage. See, here it is completely red, complete redness of eyes. See how it looks. It looks very grievous. Here there is no posterior limit for hemorrhage, right? So you should think there is trauma to head, or because of head injury or orbital injury, this subconjunctival hemorrhage happen. Okay. Next, let us see corneal involvement. So corneal foreign body shows mainly if corneal foreign body is near to limbus, then you will see pericorneal congestion. If the foreign body is embedded and if it is caused with ulceration, then you will see ciliary type of congestion, or ulceration means mixed type of congestion. Okay, this is very, very essential. After seeing pericorneal or ciliary congestion, you should think there is corneal involvement. Then you should do proper examination under slit lamp. After seeing slit lamp, you will get to know is there any foreign body. If there is any foreign body, immediately that patient should be attended. Otherwise, patient may have corneal ulceration and patient may end up with corneal opacity, and there may be permanent loss of vision. Okay. Patient complains mainly severe pain because cornea is highly supplied with nerves. Here corneal abrasion may happen. So this corneal abrasion means only corneal epithelium will be discontinued, or injury to only at the level of corneal epithelium. This will heal within 24 hours. Okay. In modern science, they'll apply some antibiotics and they'll do bandage. Within 24 hours, it will heal. In Ayurveda, we can practice Madhukruta application followed by Chinabandha is enough. Okay. Next, corneal ulcer. See, corneal abrasion you can see properly after fluorescein dye application. You can see under blue filter the depth of corneal abrasion, everything you can see under slit lamp. Okay. Next is corneal ulcer. Here you can see mixed type of congestion mainly. This corneal ulcer, at the beginning the corneal epithelium is discontinued, but along with that there will be necrosis of surrounding corneal tissue. So intraocular structure also involved. Because of that, patient will present conjunctival, pericorneal and ciliary congestion. All mixed type of congestion you can see. It's a very emergency condition. Okay. And patient may use contact lens. In such condition also, you should take proper history and see the type of congestion. Okay. Next is sclera. Here there are two major disease, that is episcleritis and scleritis. Okay. Episclera means the tissue which lies above the sclera. Epi means over or above, right? So inflammation of the tissue which lies above the sclera, episcleritis. See, there are two conditions, that is simple episcleritis and nodular episcleritis. In simple episcleritis, you can see engorgement of episcleral vessels which run in radial fashion. Okay,
Next, in scleritis, okay, this is nodular episcleritis. Here you can see nodule type, and along with that you can see the congestion. This is nodular episcleritis. Proper history you will get to know. Along with that, most of the time in episcleritis it is asymptomatic, but if you take proper history, patient says he'll get this redness repeatedly and resolve itself, but recurrence is common. Next is scleritis. Here inflammation of sclera proper. Okay, chronic inflammation of sclera, but this is a emergency condition actually. Otherwise patient may end up with loss of vision. Here patient complains of deep and boring in character type of pain. Okay, pain is very deep, and main symptom is main sign is which often wakens patient early in the morning in scleritis. So ocular pain radiates to the jaw and temple in scleritis. Okay, if you find all these signs and symptoms along with the proper examination, you can diagnose the condition very easily. Okay, here you can see ciliary congestion, see vessel redness or hyperemia of vessels within some limbus area. Okay, next we'll see the uveal tissue involvement, which causes redness of eyes. So here anterior uveitis mainly causes redness of eyes. Okay, iritis or iridocyclitis. Here mainly circumlimbal injection you can see. Okay, sunray like appearance from the limbus. There is you can see the redness of eyes. Okay, and in anterior uveitis you should see for meiosis. This patient is having pupillary sphincter spasm. This pupillary sphincter spasm indicative of formation of posterior synechiae. Okay, these points may be a bit difficult for UG students to understand, but PGs can understand very easily. So I have covered some of the points for PGs also. And in anterior uveitis, you can see aqueous cells. Okay, aqueous cells. This is you can see under slit lamp very nicely, and patient may present with hypopyon. Hypopyon means the pus accumulation in lower region, that is in anterior chamber. Okay. Even in anterior uveitis, you can see keratic precipitates which deposits on corneal endothelium. Okay, later on it appears like mutton fat. Okay, next is redness of eyes, which the disease which related to anterior chamber which causes redness of eyes, that is hyphema. So any uveitis or post-traumatic effect shows hyphema. Okay, it is accumulation of blood in anterior chamber. Okay, you can see this diagrammatic representation. Here blood collects between the iris and the cornea in anterior chamber. See how it looks. Okay. Yes, along with this hyphema, you will see ciliary or mixed type of congestion, because the involvement of structure is behind the cornea. Corneal involvement may be there, or uveal tissue involvement will be there. So you will see ciliary congestion or mixed type of congestion. And next is acute angle closure glaucoma. So this is a very emergency condition actually. Here you can see ciliary flush, ciliary congestion and circumcorneal congestion. Okay, and patient complains of severe eye pain and severe headache. Mainly the pain radiates along the branches of fifth nerve, that is trigeminal nerve. Okay, it's ophthalmic, maxillary, and mandibular branches. In that region, patient complains of pain. Okay, associated with that, patient complains of nausea, vomiting, and weakness. Here again, patient complains of rapid impairment in vision. Okay. Here always the redness is ciliary or circumcorneal, or sometimes mixed congestion. But you have to see, after seeing the congestion, immediately you should take the history properly. Then you can diagnose the case. Without examination also, you can diagnose the case many times. Okay. Let me tell you one case. You just imagine you are sitting in your OPD. Okay. One patient, 15-year-old male patient, comes to your OPD. He says, he shows his eyes that he's having redness of right eye. Okay, so right eye. Patient says he's having redness of eyes. So in your OP case sheet, you'll ask when it happened, how it happened. Okay, he says this sudden one. Suddenly, the onset is sudden redness of right eye. When it happened, he says yesterday evening he had. So from yesterday evening, any history of injury, he'll ask. That time he says he was playing in ground. That time he had hit by a tennis ball to his right temporal region. Afterwards, he had that redness of eyes and pain. No pain right now. He had bit pain around the eyes only during that time. Next day, he didn't had any pain. When he came to your OPD, he didn't have any pain. Okay. You got to know the onset, taking the history. These points are very, very important for an Ayurveda physician actually. Onset, sudden, it is not gradual one. In this case, it is unilateral, single, eye is affected. Pain, no pain. If yes, you should ask for type of pain, how it is it pricking? I told already, there is pouring type of pain in case of scleritis, and there is different types of pain explained in our shloka, in our classics. It is very, very essential for practice. And location, pain location, is it around the eye or inside the eye or associated with any headache? That is very, very important, because eye pain with headache, that is in along the branches of fifth nerve, indicative of angle closure glaucoma. Next, pattern of pain is important. Is it intermittent? Is it continuous? Or is it early morning or night? Because in scleritis, I told no, a patient may awaken in early in the morning because of that pain. Next, you should ask for burning sensation. No, this patient is not having any burning sensation. Itching sensation. No, this patient is not having any itching sensation. Foreign body sensation is also not there. If yes, you should ask for the location, because foreign body sensation may be even foreign body entry or some papilla or a follicle may cause foreign body sensation in eyes. Next, discharge. No, this patient is not having any discharge. Yes means you should ask, is it watery or purulent, or is there any bleeding? Because bacterial or viral conjunctivitis, I told no, viral it is watery, and in allergic also it is watery. In case of bacterial infection, you will see purulent discharge. Okay. Next, photophobia. No, this patient is not having any photophobia. Next, visual discomfort. No, again, patient is not having any visual discomfort. If yes, you should examine for far. You should ask for that. I mean, is he having or she is having visual discomfort for far objects or near objects, or any visual discomfort for color? That history is very much essential. And sometimes this conjunctivitis patient may patients complaints of visual discomfort. but in such condition you should not do visual acuity examination. Only after the symptoms reduces you should do visual acuity examination. Okay, because patient will have severe photophobia and difficulty to read because of that secretions and all, and you should ask for any injury or entry of foreign body. Yes, this patient had history of injury, hit by a tennis ball, right? So entry of foreign body, in case of entry of foreign body, you should ask what type of material, the place of work. Is there any iron particle entry? Then you can remove with some magnet pointing needle. There are many other techniques are there to remove foreign body. So entry of foreign body, the material, which material is entered, that analysis helps you to treat the condition. Next, contact lens usage. This patient is not having any history of contact lens usage. Yes means you should ask since when he or she is using contact lens, and the purpose is it for far or near, or only for one single eye refractive error, or any color contact lenses just for like actor or actress, how they use, are they using for such purposes, that you have to the history you have to take properly. Then systemic illness, is there any systemic illness? The common one, hypertension and diabetes. There are many more. Okay, then you have to do examination using torchlight examination is very, very essential at the beginning. By that time you will get to know the patient, how is the patient, how he is responding for the torchlight examination. Because photophobia, everything you will understand by doing torchlight examination itself. Then visual acuity examination, distant, near, then color vision if it is necessary. Next, slit lamp examination is very, very essential in case of redness of eyes. Redness of eyes, the pattern of redness of eyes, everything you will understand very, very nicely under slit lamp examination. So repeated slit lamp examination, if you do, you will get to know the pattern of redness and the severity, the structure involved properly. Even the severity of disease is understood and it becomes easy to diagnose. Okay, so you must test if patient is having history of the signs and symptoms looks like dry eye, then you should do basic test, that is Schremer's test. You'll get to know if patient is having any dryness. If it is mild, sometimes Schremer's test may the chance of missing that diagnosis, the time you may need to do T-BUT test. Okay. Next, examination with direct ophthalmoscope if it is necessary. According to the history and signs and symptoms, you should do other examination. Okay, this condition is nothing. This condition is subconjunctival hemorrhage, right? So this subconjunctival hemorrhage can be correlated to Arjuna in Ayurveda, Shuklagata Vyadhi. For UGs, this Shuklagata Roga is done, right? So I have took very simple disease, that is Arjuna. Suhruta and Bhagbata both are saying that it is having Shasharudhira Upama, right? Shasharudhira Upama, it looks like the color of rabbit blood. Why he said Shasharudhira Upama? Why not Raktavarna or Tamravarna? Because it's clear, Shasharudhira is a simile for Prakrita Rakta Varna, right? According to Vagbata, Prakrita Varna Lakshana, one of the Prakrita Varna of the Rakta of human being is Shasharudhira Upama, like Shasharudhira. So here in subconjunctival hemorrhage, the blood is not infected. It is a pure blood. It is Prakrita blood, okay, which is least inside the subconjunctival hemorrhage. It is not infected one. He says Eka Bindu. Okay, there is one single spot. But don't think by seeing patients, there may be sometimes double, you may see petechia like hemorrhages. There may be multiple. By seeing that, oh, this is not Arjuna, don't come into such conclusion, because Ayurveda shlokas are having very deeper meaning, and theory is something bit, there's a lot of complication if you apply theory as it is in practice. Practice is bit different, and you are applying your, you have to do lot of work, and you have to apply the theory concepts properly while doing practice. Okay. So here Bindu, he says. Bindu means just, don't think it's just a spot. There is Bindu Pramana, he says. Bindu Pramana means there is leakage of blood. It may be in Bindu Pramana. Only that much leakage of blood may happen. Okay, it is left to analysis of Vaidya. Yukti of Vaidya is important in Ayurveda. Okay, while treating the patient. Where it exactly happens? It happens exactly in Shukla Bhaga, that is in conjunctival region, you can think, or in scleral region. Okay, Shukla Bhaga, so in Shukla Mandala, this Bindu, Shasharudiropama Bindu appears. So it is called as Arjuna. Vagbhata adds two more points, that is Niruk Shlakshana. Niruk means there is, Ruk means pain. There is no pain. The direct word meaning is Ruk means pain. But Ruk, that word meaning, one more meaning is that is discomfort. Okay. There is no any discomfort. Patient is not having any photophobia, no foreign body sensation, no burning sensation. Okay, just patient is no pain. Patient is not having any other discomfort. Shlakshana means what? Shlakshana means smooth. Smooth or even. Surface is even. There is no, surface is not get disturbed. Okay, after injury, after seeing subconjunctival hemorrhage, there is no chemosis or something. There is no, surface is not get disturbed. It is even. It is smooth. Okay, as it is. Okay. Next, similar explanation how Suhruta explained. Next, after seeing the disease, after analyzing according to Ayurveda, very essential thing is the dosha avastha, dosha dushya avastha, and kriya kala is very, very important for each and every disease in Ayurveda. Okay. Then dosha, in Arjuna it is Raktaja. It is Raktaja. Sadhya sadhyata is very important while treating the disease. If you can treat, you can treat in your OPD. If you are not able to treat, the referring is also very, very important. Referring is also duty of doctor. Okay. The referring in right time to right doctor is the duty of each and every Vaidya. Okay. Chikitsa Sutra, you have to analyze Chikitsa Sutra. Once you get to know the Vyadhi, then you have to analyze which Chikitsa Sutra is suitable for this disease. So for Arjuna, Vagbhata says Arjunesha Raktabhishendavat Pratikuryat. Suhruta also says Paitam Vidimasheshena Kuryad Arjuna Shantaye. Suhruta goes to the root. Vagbhata superficially explains Raktabhishendavat Pratikuryat. See how? Raktabhishenda is, if you go through Suhruta, Raktabhishenda Chikitsa, okay, Raktabhishendavat Pratikuryat, you will open Raktabhishenda Chikitsa chapter in Suhruta, and you will see again there you will find one more Chikitsa Sutra, that is Pittabhishendavat Kuryat, Pratikuryat. Okay, again if you go to Pittabhishenda Chikitsa chapter, there you will get Pittahara, all Pittahara vidhis are can be essential, can be done for this Raktaja Netra Roga, that is for Arjuna. So Suhruta says directly Paitam Vidimasheshena Kuryad Arjuna Shantaye. Okay. Once you get to know the Chikitsa Sutra, just apply Chikitsa. That is, Nidana Parivarjana is the main point according to Ayurveda. Then you have to analyze Nidana, and then Patya, Nidana Parivarjana means again Apatya. You are avoiding Nidana, all Apatyas. Then you are advising Patyas. Here you are advising
all Pittahara and Rakta Prasadaka Ahara Viharas like Kshira, Kshirana Bhojana, Krita. According to the patient palatability and patient convenience, you have to advise Patyapatyas. Okay. Next, Aushadha. After Nidana Parivarjana, again, the role of Vaidya is giving Aushadha or Kriyakalpa in Netra. Okay. This patient, if you see classical book, you'll get many Ashtotana and Anjana preparations for Arjuna. All are mainly Pittahara and Rakta Prasadaka Dravyas. Okay, you can practice Netra Seka also in your clinics. Pittahara or Rakta Prasadaka Dravya, but Purusham Viksha. You have to see the Prakriti Bala Vayas of patient every time. Okay. Clinically, there are many preparations explained in classics. Which is comfortable for you, which is convenient for you, you can practice those medicines for Ashtotana, Ranjana or Netra Seka. I usually prefer Yashti Madhu or internally some Arogyavardhini or Avipattikara according to the condition, according to the patient Bala, according to the other Vyadhi. If patient is having diabetes or hypertension, I have to see those condition also I have to consider and give the medicine. So next, Yantra Shastra Prayoga is there any Yantra Shastra Prayoga is required in that condition? No, in this case not necessary because it is Aushadha Sadhya Vyadhi. Right. Okay. So at the end, this redness of eyes or condition, different patterns, you have to practice repeatedly. You have to see many cases, then only you will get to know the involvement of structures, seriousness of disease, everything. So this redness of eyes, if you understand properly, you will get to know the seriousness of disease and the structural involvement you will get to know. By that, you can do proper diagnosis along with proper history and associated with signs and symptoms, and appropriate examination helps you to do easy and early diagnosis. By that, if you do proper and early diagnosis, of course you can give exact early treatment to avoid further complications. So, in case of corneal foreign body, if you do delay the treatment, or even after seeing pericorneal and ciliary congestion, if you think patient is having redness of eyes, I'll give some medicine which reduces redness of eyes, eye drops, and if you send the patient, within 2-3 days patient comes to OPD with the complaint of severe eye pain and corneal ulceration. If corneal ulceration becomes very much active, then it's difficult to treat. It takes a lot of time. Okay, and there will be permanent corneal opacity, and many times there will be a permanent loss of vision. Okay, so exact and early treatment is also eyes properly to you can avoid further complication by that. Okay, so do you have any doubts? Thank you.
Yes. Thank you, ma'am. It was a very informative session. Before we go to doubts, I would like Pasha sir to speak a few words. Sir, you can just unmute yourself and you can speak.
Hello everyone.
Yeah, good afternoon, sir.
Very good afternoon everyone present in this session. So today we had a great presentation by Dr. Vijayalakshmi on topic how to approach red eye.
Hello.
Hello, can you hear me?
Hello, Vidya ma'am, can you hear us?
Hello everyone.
Yes, sir, we can hear you, sir.
Dr. Vijayalakshmi madam.
I'll just call her, sir.
Sir, I think ma'am has problem, like she's not able to hear us, I think, sir.
Okay, you just request her to unmute her, no?
Yes, sir, we are able to.
Vidya?
Yes, sir.
Yeah, yeah.
Namaste, sir.
Namaste. How are you?
Fine, sir. How are you, sir?
Okay. I'm fine. I'm good. Actually, I wanted to speak to you before this commencement of this session, but I couldn't do it.
Yeah, sir. I thought nobody is there. Only students are there.
No. I was asked to log in. So
Okay.
that time only I just downloaded that app. I couldn't do it
Yeah.
because I was not knowing much about that
Google.
technical issues.
Yes, sir.
So,
The-
dear student, so today now we had a just wonderful presentation by Dr. Vidya Lakshmi, assistant professor from Bangalore Talpadi Ayurvedic College, and she had very enthusiastically agreed to deliver her presentation, and she has done very well, excellent, and very meticulously, very specifically approached how to diagnose these conditions and explained very effectively different perspectives. So I hope everyone has benefited from this. It was very informative. So I thank Dr. Vidya Lakshmi for being with us till now and delivering his wonderful speech on red eye and enlightening all our student community. Really, it was very lot to us, and I
Thank
hope
you.
and believe in future also
Yes, sir.
will coordinate with us. Will continue to commence this kind of start with this kind of important and wonderful sessions in future also. I am very much sure that he will enlighten us in future also. So,
Yeah.
thank you, Dr. Vidya Lakshmi, for being with us. Thank you.
Yeah, thank you. Thank you so much, sir. I would like to thank GMC Bangalore Principal Dr. Ahalya ma'am and
Sure.
all Sharaka department staff, especially teacher, sir, Pasha
It
sir
was
and
nice to
Rati
hear
ma'am. Yes, sir. He was my teacher
Once
in UG and PG both.
I am proud. I am very much proud and happy.
Yes. Something if I learned, it's because of you, sir. Actually, in UG, it was because of you. And
No.
special thanks to my lifetime guide, that is Dr. Suja ma'am.
Very
for
well,
giving
very
me
well.
this opportunity, sir. Thank you so much.
Thank you. On the behalf of department and Dr. Rati Madam, Avinash Madam, Mumtaz, and on the behalf of the Redness Institute, Dr. Ahle Madam. So, on the behalf of this esteemed institute, I thank you, Dr. Vidya Lakshmi.
Yes, sir. Thank you. Thank you so much, sir.
Okay,
If,
you conclude, Dr. Saundarya?
Yes, sir. Okay, sir. I have few doubts are there, sir. We'll just ask.
Yeah,
the
go
question.
ahead.
Yes.
Yes.
Let it continue for the doubts.
Yes.
Uh,
The first.
Before that, my dear students, the thing is, I just want to tell you, clinically, practically, just when you see the disease, don't apply the modern concept directly into the Ayurveda. Okay? What were the concepts you are learnt in first year? All Ayurveda Siddhanta is very, very important to treat the Ayurveda diseases, even in Shadakya. We are limiting many times according to modern. Okay, I saw many retinal diseases. Even when I was practicing in PG, some cases I left, but I have treated here retinal diseases. We can give very nice treatment, but you have to apply Ayurveda Siddhanta properly. Dosha Doshya Siddhanta is very much essential. Okay. Yeah, fine.
Yes, ma'am.
Tell me, Sandhya.
Yeah, the first question is from Dr. Praveena, final year student. How Madhu Grita application help in corneal abrasion?
Yes, it's directly explained in our classics. Okay, Madhu and Grita combination. If you go through the chemical composition of Madhu and Grita, you'll get lot of research works. It is having lot of healing property. But this corneal abrasion, no? Corneal epithelium without any medicine also heals by itself. If you don't touch the condition, corneal abrasion, because corneal epithelium is having regenerative character. It will heal by itself. So just to avoid further infection, if corneal abrasion is exposed to external environment, there is chance of infection by bacteria or virus. So there may be chance of corneal ulceration. Avoid that. Just this antibiotic drops or gels used by modern people. But for us, Madhu and Grita is more than enough. It is having many antibiotic, antibacterial, antiviral, even anti-inflammatory activities, Madhu and Grita. So this application along with bandage is more than enough. And even corneal, after corneal ulcer, if you go through Vagbata, after corneal ulcer, there are many preparations mixed with Madhu and Grita. There are many medicines mixed with Grita and Madhu. So this is having very good healing property actually. Along with it avoids the infection, further infection by bacteria or viral. Even it reduces inflammation also. Okay. Yeah.
Yes,
Next.
Okay, thank you, ma'am. How to examine pupillary sphincter spasm?
Yeah, that is very. You have to see under slit lamp. Okay. Here meiosis, you can see meiosis and mydriasis. You know very well, I think. Meiosis means the pupil becomes constricted. Normally, pupil will dilate and constrict. If you put a light, there will constriction of pupil. And in case of this dim light, this pupil will dilate, right? Because the beginning of synechia, the posterior synechia, this iris gets adhesion with lens sometimes. In case of uveitis, usually anterior uveitis. So such condition, this pupil will not react. Okay, there is no dilatation and relaxation. Dilatation and constriction. For torchlight only you can see. With torchlight only you can see. There is no dilatation and constriction of pupil. So you can think there is pupillary sphincter spasm. Okay. It is indicative of posterior synechia. Next, further there will posterior synechia will happen. You can think there will be beginning of posterior synechia. Okay.
Thank you.
Yeah.
Next question is how to remove the iron particles using magnet, as you mentioned earlier.
Yeah, if it is superficial, very superficial, you can use magnets to remove the iron particles. Even there are many, if there are any iron particles which is embedded, for that there are some, sophisticated instruments are there which is having magnet tips, etc. Usually the Ayurvedic doctors are not come across such conditions and we are not practicing mainly, as I know. Okay. Next.
Yeah, I think that's it, ma'am. The question. Anybody wants to ask
Okay.
anything? You can ask. Yes, ma'am.
Okay. If you want to ask any question, they can contact me through mail.
Yes.
My mail ID IUDRVLT.
You can send them, ma'am. I will put it in the group. I can give it to them. If you send
Yeah,
it to them.
sure.
Yeah. Okay. Okay.
And,
Thank you so much, ma'am.
Okay.
For this
No
very nice
problem.
session, taking your time out and spending it with us. Thank you everyone for
Okay.
attending and listening.
Was
to
it
the
beneficial?
session. Yes, ma'am, it was beneficial.
Thank you. All are my
It
juniors.
was very
because I
impressive.
studied.
It was very impressive and very effective. In fact,
Thank you, sir. Thank you so much, sir.
lovely.
I'm
Thank you,
so
everyone.
happy to take this guest talk for my own college, my own mother institution. Thank you so much, sir.
Thank you very much. Thank you.
Okay.